Welcome! This video is part 7 of a 9-part series and is intended for state, tribe, and territory disaster behavioral health coordinators and others involved with disaster planning, response, and recovery. This video focuses on logistical support. During this video, we will cover the following learning objectives. The first objective is to identify the critical elements of logistical support before, during, and after a disaster. The second is to understand the 3 main groupings of an effective disaster behavioral health plan's logistics section that is compliant with the National Incident Management System, or NIMS. Finally, you will learn approaches to using volunteers and voluntary organizations active in disaster, also called VOADS. The NIMS concept of logistics helps us shape and form a NIMS-compliant incident command system, or ICS, approach to the logistical support needs for disaster behavioral health. Let's look at logistics bucketed in 3 categories. Those categories are personnel, partners, and communications. Personnel discusses how disaster behavioral health responders are recruited, screened, and trained, as well as how teams are formed, deployed, and supervised out in the field. When we discuss partners, this covers working with partners across state lines through an Emergency Management Assistance Compact, or EMAC, and items such as a Memorandum of Understanding, called an MOU, to written agreements and relationships with local VOADS. Lastly, communications include mechanisms for notifying and deploying personnel and processes to receive timely information in the form of situation reports, safety briefings, and so forth, so that all planning and response partners are always in the loop. Now, let's examine these categories in detail. The first is personnel, the people involved. Your plan should include descriptions of your available pool of potential disaster behavioral health responders. In doing so, it is helpful to detail how disaster behavioral health response capabilities are developed in the state, territory, or tribe. These capacities include specifying how potential responders are identified, recruited, screened, trained, supervised, and retained. Your plan should include information that addresses cross-training between other types of emergency management personnel, public health workers, and your disaster behavioral health personnel. This will help ensure an understanding of what your scope of expertise is, where you could help most, and how your office plugs into the larger command structure. It is important for team leaders and supervisors in the field to know how many disaster behavioral health responders are deployed at any given time, and the status and whereabouts of those personnel. There should be clarity in command and control, a clear check-in and check-out process, and the ability to reach those responders quickly to inform them of updates or changing operations. An effective logistics section describes how disaster behavioral health personnel are rotated, backed up, and even demobilized. Logistics is very often thought of as stuff, but it's also about access to tools and resources. It may be important for disaster behavioral health responders or team leaders to have access to laptops and other sorts of communication devices, to access internet or web-based resources, and to communicate seamlessly throughout their command and through the response chain. In this context, indicators of a NIMS-compliant logistics section also comprise a list of items responders may need to successfully deliver disaster behavioral health services. This section of the plan may discuss vehicles and communication devices such as radios or mobile phones. If the state plan describes the possibility of on-demand training to bring more responders into the loop, then your plan also needs to discuss what kind of platforms and equipment would be necessary to deliver those on-demand trainings. The logistical section of your plan should detail how you will structure a team, including how many personnel will be on a team. That outreach will be done in teams of at least 2, and how many pairs should report to a single supervisor. The recommended optimal number is 1 supervisor to 5 workers. This ratio can be in the range of 1 supervisor to 3 workers on the low end to 1 supervisor to 7 workers on the high end. In addition to your own agency personnel, a comprehensive response includes partners and logistical coordination systems to support these broader networks. Federal programs such as the ESAR VIP are designed to help register and coordinate health professionals and others who have indicated their interest in volunteering to assist during an emergency. EMAC is an organization specifically established to manage interstate resource requests during a disaster, and as many of you know, the MRC, part of the larger Citizen Corps, coordinates a range of public health volunteer workers to respond to different types of emergencies and disaster scenarios. Volunteers and VOADS are an important part of the resource mix necessary for a successful disaster behavioral health plan and should be described thoroughly in your logistics section. Clarity of the roles and responsibility of the volunteer organizations is essential. Your plan should anticipate and describe even how spontaneous, unaffiliated volunteers may be used to supplement a more sanctioned disaster behavioral health response. Many states have faced challenges around issues of liability for protection for volunteers. As a result, some states simply avoid using volunteers due to liability concerns. Several states have developed volunteer protection statutes for individuals affiliated with state disaster behavioral health response teams, and they afford these volunteers some degree of protection if they are deployed in sanctioned outreach. States with credentialing programs also address the liability issue in part via careful screening and background checks. They also conduct mandatory training in disaster behavioral health skills and topics such as ethics and cultural competencies in disaster response. Finally, let's briefly discuss communications, how teams are notified of an impending disaster or crisis, the process for deploying and transporting them, and the communications used by personnel working in the field are very important. In addition to identifying who will communicate disaster-related information to your responders, your plan should articulate how the information is shared, whether it is in bulletins, advisories, warnings, or guidance. Part of this discussion may also focus on a call-down list or the other methods for sharing information. Communication with disaster behavioral health responders and other response agencies is very important to the overall plan and to the logistics section. It may be helpful to think of it as 3 T's: target, timing, and type. Target is who you need to communicate with. Is this your responders, other partners such as public health entities, other agencies, and so forth? Once you have thought that through, consider the next question about timing. When do you need to communicate with them? Together, target and timing inform your decision about type of communications: telephone, text messaging, and so forth. Lastly, how do you actually get to the event site to deliver services? This also becomes a question of transportation, a key component of logistics. Determine pre-identified disaster behavioral health staging areas as well as ad hoc staging areas. Consider modes of transportation, such as personnel vehicles, state vehicles, and partner agency vehicles. These basic factors will ensure personnel get where they need to go. This concludes the logistical support video within the Promising Practices series. Thanks for tuning in. The other videos in this series will explore each of the standards that can enhance your state disaster behavioral health plan. To view an expanded version of this video, go to www.samhsa.gov/dtac/webinars-podcasts and scroll down to the Promising Practices in Disaster Behavioral Health Planning series. Established by the Substance Abuse and Mental Health Services Administration, SAMHSA, the Disaster Technical Assistance Center, DTAC, supports SAMHSA's efforts to prepare states, territories, and tribes to deliver an effective mental health and substance use-related response to disasters. For training and technical assistance inquiries, you can call SAMHSA DTAC toll-free at 1-800-308-3515 or email dtac@samhsa.hhs.gov. or you can visit www.samhsa.gov/dtac. Before we conclude, we'd like to give a special thanks to Steve Cremando, who contributed the original content of this video.